Hello, this is Dr. Daniel White, and I'm bringing to you this episode of 5 Minutes Diabetes. As you know, in Singapore, 11% of Singaporeans have diabetes, and we have declared a war on diabetes, and the whole government, the whole country has been trying to bring back this diabetes under control. So I want to talk about what is diabetes mellitus. When we talk about diabetes, we're talking about diabetes mellitus. What does diabetes mellitus actually mean? Well, I'll give you some hint by telling you the Chinese, which is 糖尿病, and the Malay called kencing manis. So as those names imply, the diabetes mellitus means a condition when a patient passes sweet urine. And that diabetes mellitus is just the Greek name for diabetes. So you may think, that is all very good, but how did the doctors in the ancient Greek world know that the urine of the patient is sweet? Well, you get it. Actually, in the olden days, in order to diagnose diabetes, the doctors would need to taste the patient's urine to see whether it's sweet or not. Sorry. Fortunately, nowadays, we no longer need to do that. But sometimes, some patients, when they're first found to have diabetes, they will actually realize that any urine that they pass, ants, they will see crawling towards the urine, and it does happen. Fortunately, with earlier pickup, this should not be seen so frequently nowadays. And then, in the previous generation, we used to use a dipstick that you can buy from the pharmacy to see whether there's any leakage of sugar in the urine, and then it changes color and telling us whether the sugar is possibly 1+, 2+, or 3+. But nowadays, for better diagnosis, we generally would ask the patient to do a fasting blood test. So for the fasting blood test, it's really straightforward. I just need you guys to remember two numbers, 6 and 7. So for the fasting sugar, fasting, how do you do it? Well, after an 8-hour fast, you go to the doctor's office or the lab, and then they're going to draw blood. And for fasting sugar that is less than 6 is called normal. Between 6 to 6.9 is called pre-diabetes. And then more than 6.9 or 7 and above is called diabetes. And then we also do the 2 hours after a glucose tolerance test. So the OGTT, a glucose tolerance test, is when we want to do a more complete analysis, want to pick up patients who may have normal fasting but high 2-hour post-sugar challenge. And what happened is that we give the patient a very sweet glass of juice containing 75 grams of sugar, and then we check the glucose 2 hours after. So both fasting before drinking the juice and 2 hours after drinking the juice. And that is, I want the number to remember is 8 and 11. Okay, so roughly, but in actual fact, if the 2-hour post OGTT glucose is less than 7.8, then it's called normal. Between 7.8 to 11 is called pre-diabetes, and then 11.1 or more is called diabetes. So fasting 6, 7, 2 hours after OGTT, roughly 8 and 11. Sometimes you may see a doctor for other things, and then a blood test is done which is random, which is not fasting and is also not 2 hours after. Then we will actually take the 11.1 as a cutoff for the diagnosis of diabetes. Then nowadays we also have another way to diagnose diabetes, which is called HbA1c, hemoglobin A1c. So what happens is that when there's diabetes, blood sugar is high, the sugar actually gets stuck to everything in our body, and one of the things that it gets stuck to is the hemoglobin particle, and that's the red coloring pigment that transports oxygen in our blood, and that's the thing that makes our blood red. So HbA1c is the sugar particle that is attached to this HbA1c, and if this HbA1c is less than 6%, it's called normal. Between 6 to 6.4% is called pre-diabetes, and more than or equal to 6.5% is called diabetes. So with all these tools, we can actually pick up almost all the cases of patients with diabetes. So enough about what is diabetes, and glad to see you. I'm Dr. Daniel White again, and then I would like to speak to you again about other topics of diabetes. Bye!